History will record that this week was the beginning of the end of the coronavirus pandemic.
The U.S.'s mass vaccination campaign is underway, nearly a week into the effort to eradicate the COVID-19 pandemic, and tens of thousands of shots have already been given to nurses, doctors, and our nation's leaders. Vice President Mike Pence is so far the highest-ranking official to get the vaccine, doing so on camera in hopes to be an example and ease the doubts of worried Americans.
Karen and I were more than happy to step forward before this week was out to take the safe and effective coronavirus vaccine that we have secured and produced for the American people.
The vice president says the U.S. is poised to have enough vaccines for 20 million Americans before the end of the month, timing that few thought possible at the start of the pandemic.
It is truly a medical miracle.
A feat that experts say should be celebrated, not criticized.
Well, let's take a look at what's happened over the past few months. We've had clinical trials, and thanks to the volunteers in that trial, in tens of thousands who have put themselves on the line to prove to the country and the world that these are safe and effective products.
Convincing Americans of its safety isn't the only challenge to health officials. At the moment, few doses are even available, meaning right now the biggest issue is agreeing on who gets first access. Starting with healthcare workers was the obvious first choice, recommended by an expert panel for the CDC, along with nursing home residents. And so far, that's what most states have been following. The CDC's expert panel is set to vote during an emergency meeting this weekend on who should be included in the second round. But ultimately, each state decides its own plan using the panel's recommendation as guidance. Talks between the panelists up to this point have implied the next round will likely include essential workers who don't have a choice to stay home and are the people getting infected in the highest numbers, or people 65 and older, as well as those with certain medical conditions who are dying at the highest rate. Though, of course, the ultimate solution to this challenge is simple: more vaccines, and that is imminent, anticipated by experts to come for all Americans who want one by mid-2021. The solution to the former problem, actually getting Americans to want one, is hard to say, but our nation's leaders are hoping they can help. Reporting for NewsNet, I'm Abigail Taylor.